Debbie?
Thank you for having me. Good afternoon, everyone. I'm excited to present, and it is always a challenge. So Mary will watch and see if there's any questions or things, and we have a lot to accomplish. So I'm excited to be here. I always give a tiny bit of credibility to myself. I've been working in the field for almost 38 years now. Worked in adult residential for mental health, addiction. I've been a family therapist. I've done employee assistance work for Procter and Gamble and GE. And my most favorite clients to work with are any, because I'm an optimist who sees that people can change. And sometimes the change is tiny and slow, and sometimes the change is absolutely amazing in how fast people go. So I'm looking forward to sharing with you some things to make you think and give you some assignments at the end that will help you grow, whether you're in the field for 6 days, 6 months, or 60 years. So let's get started. Oh, first thing is it's not going to advance my slide. Oh, there it goes. Um, So, one thing that I will share is because I work both in mental health and in addiction, I use the word peer support and recovery coach in this presentation very interchangeably. So, if I slip one way or the other, I'm presenting information that'll work for people on either credential. Um, I really have a passion for training people, and my goal is to really help you increase your skills by the time you are done with this so that you feel more competent, because that's what keeps us in the field is when we're working in our sweet spot where we feel competent and able to give to other people. So our objectives are pretty broad today. We're going to first start talking about the stages of recovery. We're going to learn about the stages of change and why those are very important for people in recovery and for those of us working to help people in progressing through their recovery. We're going to identify ways to roll with resistance because all of us have had clients that just repel us away. Their brokenness, their hurting, their maladaptive coping mechanisms just kind of can be hard to change. We're all about inertia. If it's not really uncomfortable, it's hard to change. So I want to give you skills so that you're not being pushed away by your clients, or contributing to that resistance that happens. And then the last thing we're going to do is we're really going to focus on developing strategies for creating really helpful recovery plans, instead of ones that are just complying with funding sources and have check boxes, but ones that clients will really want to utilize, and you'll be able to help your clients in the sense that it'll be meaningful for both of you as a guidepost. So let's start by identifying the stages of recovery. And I have based my work on the book that was authored by Catherine O'Connell. She was a registered nurse and a mental health practitioner, and she wrote the book Bruised by Life: Turn Life's Wounds into Gifts. And her goal was to really help focus on the fact that recovery is an ongoing process. We always talk about diseases that have progressions, but we really need to make sure that we understand that recovery is not a destination, it's a lifelong journey. So she describes the first stage of recovery being stabilization. And this stabilization really happens in the first year that people begin to realize that they want to do something different, or somebody has told them they need to do something different. And it's characterized by this firmness of purpose. There's a public statement that I'm going to do something. I'm going to learn about addiction, or I'm going to work on my mental health, or I'm going to focus on my anxiety, or I'm going to really learn about my medications. But there's some statement of purpose in that beginning process and stage one. The other parts of the stabilization is really learning to socialize in group settings, because addiction and mental health really have caused isolation patterns, and it causes people to repel other people away. So, first, to be able to stabilize in group settings and socialize. It also is a time when people really are focusing on anxiety management, because even if somebody doesn't have anxiety as a diagnosis, there's a lot of anxious feelings, worrying, rumination when you're trying to change something. And we can probably each reflect on a time that you've tried to change something, and it makes you think and worry. Um, the other part of stabilization is making sure that you're staying away from those risky places or risky people, and overall beginning to come up with a self responsibility, starting to take accountability, and then learning to ask other people for help and support. So that first stage in that first year of recovery is very vital. And when we think about funding sources, people are always like, "Oh yeah, we're going to give you a few sessions to do this," or you've been doing X for 30 days, so it should be all better now. But this is just the first stage of recovery, and it takes about a year to do that initial stabilization when you're working on changing your mental health or your addiction, stabilizing medications. The second stage of oops, admit somebody. The second stage is what is referred to as the deepening stage. And this is really when people start to, I call it peel the layers of the onion, starting to look at what are those old behaviors that somehow don't feel right anymore. Oftentimes we have behaviors that we think are working for us, but as you start to challenge yourself and you start to have healthier people around, you begin to identify that, that sleeping in until noon doesn't really seem to go very well. It makes me feel groggy, or, not eating well makes me feel a certain way. So people begin to increase the quality of their physical health because they're seeing what's working and what's not. Also, in this deepening phase is the ability to tolerate feelings. Um, Change again is hard, and oftentimes we as humans don't want to feel uncomfortable. And when you're struggling with your mental health or addiction recovery, or a combination of both, and then you throw in maybe a physical health issue as well, it's really uncomfortable. And people like, I don't want to feel sad, I don't want to feel anxious. But now in this deepening stage, people are beginning to realize that it's tolerable. You can be sad without getting into that dark despair, and you can be anxious and worried without it causing you to ruminate to the point that you are self-harming, for example. The other thing is people begin to distinguish between their feelings. Instead of everything being terrible or fantastic, there's the ability to somatically identify that that's a little worry versus that is terror. And so being able to say, gosh, I'm feeling happy, joy, ecstatic. So the range of emotions are expanding all the time. And then the other thing that happens in this second stage of recovery is people are really increasing their commitment to do the hard work. There's an understanding that it's not going to come easy, and you get out what you put in. And so that's important to realize that people are making a commitment to themselves now. You can hear people sometimes say, well, I feel a little selfish now because I've said no to certain things, and I'm asking other people to do things with me and for me, because it takes energy to work on your recovery. The third stage is the connectedness stage. And you would think that this would come earlier in recovery, but what we've found statistically is normally it starts to occur at around 3 to 5 years of sustained recovery work and wellness work, that people are start to have more joy and less misery in their life, and they're learning to have less drama in their life, because as you start to balance your emotions, you're not repelling people away, or you're not attracting people that also like to be emotionally dysregulated. And so you find that your connections are wider circle of people, both in recovery and out of recovery. You find that you are able to begin to reflect in a more meaningful way with people. Um, and a lot of that happens because in this stage, rigorous honesty and, just telling the truth. Like, instead of somebody saying, "Well, how you doing today?" and you faking it, you're like, "I'm having a really hard mental health day." And then it's people more likely want to connect with you if they see that you're genuine, because when you're incongruent and you're looking sad and down and you tell everybody you're fine, well, what am I going to do with that? Versus if you're like, "Hey, I'm struggling a little bit." "Oh, well, what would you like to do? Can we go for a walk together? Would you like to talk? Do you want to go to a meeting?" Um, it helps people feel more connectedness. Um, the other part of this stage of connectedness and around the 3 to 5 years is sometimes people realize that they need to go back and revisit or redo the earlier things in recovery. When we have people that have worked their 12 steps of recovery for addiction, you oftentimes hear them around that 3 to 5 years, like, "Oh man, I need to go back and make some more amends to people, or look at my character flaws in a new and different way." And then the fourth stage that was described in the stages is the integration stage. And this is 6 to 10 years. We're talking a decade. And this is when you begin to hear people say, things are really starting to feel like a new normal. They're feeling like they're becoming a whole person. They're avoiding, I call it stuckness, that instead of everything being hard and feeling like you have galoshes that you are filling with concrete, things are becoming a little more automatic. The kindness that others are beginning to demonstrate is also self kindness or self forgiveness, which allows people to embrace that I am perfectly okay, even with my struggles, or even with the past hurts and failings and whatever. And that life becomes more joyful, there's more fun in life, and the ability to navigate those struggles, because you have more healthy people in your life. You've figured out physically how to navigate in a better way. And overall, there's just this ability to act on the knowledge and the insight that you've been gaining over all the things, because we're all different. If somebody is like, "Man, I need this much sleep," but they've gone through a stage of life maybe where there's a aging parent or a new child in their life, and like they're not getting the sleep they need, they now know how to say, "I need some quiet time," or "I need somebody else to assist me." So being able to integrate all the things that you've learned. And then the final stage was contributed to Phil Valentine, and he did the Recovery Coach Academy. And what he described is the last one is characterized by people that have 10 or more years of recovery, and they're in this discovering and following through life. Looking for things that bring them peace and serenity, looking for things that give them purpose, a meaningful purpose in life. The ability to have less worry is there, because the confidence comes from not only the confidence in skills and the confidence that that you're not going to be emotionally swinging all over in the range of emotions, but that you can manage your emotions. And then this confidence comes from this humility of, Yep, I know some days are going to be good, some days are going to be a struggle, but gratitude is really what guides people. And I would attribute this, if I was describing it, as this is kind of Maslow's hierarchy that you get closer to the self-actualization. What is it that your purpose and goal? Because in the early stages of recovery, you've done the basic needs and the safety environment. So I would like anyone that's comfortable to go ahead and open their mic. And does any of this ring true for you? Um, what insights can we gain, particularly when we're trying to relate this to being a peer support or recovery coach, by knowing that we have these stages of recovery? I can only see some of you at any one given time. Some of you, I can't even see your thumbs. So does any of this ring true? Kind of a thumbs up that, whoops.
Uh, yes, it rings true, but sometimes you bounce in between. Even I have like 30 years in recovery, and
Mhm,
I know sometimes I can bounce between the stages, even though I
mhm.
got 30 years.
Absolutely. And we're going to talk about that in the next stage is it's not a linear progression where you go 1, 2, 3, 4, 5. You might go 1, 3, 5 back to 2. Yeah, how all over the place because life is different. Yeah.
Mhm.
Yeah.
I tell people it's a roller coaster.
Mhm. Yes, yes. Whether you're going right, going left, up the hill, down the hill. Yes, yes. So what's really important as a recovery coach or a peer specialist is to realize that if you understand that recovery is a journey and a process, then you understand why it's so important to figure out and continually assess where is the person that you're trying to help in their recovery process. And that could be changing day to day. But also, as a theme, where is this person at? What is their particular goal? Are they in stabilization? You're going to treat them a lot differently and have different goals than if they're moving further along in their recovery. Um, so I kind of summarized these already, but recovery and wellness is a lifelong process. Um, and one's full potential only can occur after those basic needs are met. So if you want to help somebody with their personal growth, creativity, self-fulfillment, we have to make sure that they have food to eat and that they have a safe place to lay their head at night and that they have medications that will help them be stabilized, that they have you know gainful employment or other means of income so that they're not having to put themselves in risk by things that they're how they're gaining their income, and that specific recovery forms vary based on each individual person. Um, and that the first year of recovery is intense. People need other people to support them in developing these new skills and the new identity because people have shared their own words, I'm always this or I'm always that. And if you're like, well, I've always been depressed, well, you don't have to always be depressed any longer. But we will do self-fulfilling goals if we don't realize that we can put other people in there to counterbalance some of our thoughts and our actions. Any other themes or thoughts about the stages of change? And
I'd like to make a comment. Can you hear me?
yes, Sandra, thank you.
Okay. I'm so grateful that you this have are talking about this. I had never heard of this part. I am a recovering alcoholic addict, and I'm a substance abuse counselor. And then I retired for about a year, and I took this course of peer support. And I can see now why I am kind of, it's been a year now that I've been in this. in this particular field, but I play different roles. Why I feel like I'm going up and down, kind of like a yo-yo effect. And I have a very strong recovery, but I start to question it sometimes. Is that normal?
It absolutely is normal. And I'm so excited that you're here with us today because we're going to be talking about the things that when we, as the coach, when we push too hard, they'll pull and tug, and then we get that rebound effect, which is also their rebounding. So it is very, very typical, but we oftentimes don't identify it. I teach a lot of my team members that we are going to be dancing with the addiction or dancing with the discord because you don't want to repel the person away with your high expectations or judgment, and you don't want to have them run away. So you got to do the fancy waltz with them all along the way. So yeah, it's very normal. Gabriella, I see you. Oh, go ahead, Sandra.
Oh, I just wanted to say, I totally agree with that because I do, peer certified peer support. I do. I'm doing some substance abuse groups now, and then I do CBRS. And I've never. I thought I played all these roles all the time, but as you break them down, each one they are different, but it's still the same.
They are. They have a lot of the same skill sets. Yes.
Yes. Okay.
Gabriella, I see your hand is raised.
I want to take myself off the video so you can see me. Hi.
Hi, Gabriella.
Hi. I was just reading this, and I guess what came to my mind on this is that sometimes I think when people are in recovery, like where it says they can offer basic needs are met and all that, a lot of times they don't really know because they've been in some kind of form of whether it's like addiction or a situation that they've been in. They kind of don't even know how to identify what their goals probably are or where this creativity comes from and things like that. So that can make it kind of hard too. So they're kind of like finding out themselves, their own identity in a new identity of no longer being in wherever that they're at. So that's always
absolutely.
Yeah.
I agree with you. And we're going to get to that when we start talking about how to create a wellness plan. I've got some questions that you can ask them to think about, and you can reflect on how you've talked about things. So we will get there and hopefully give you some specific examples to use. So, yeah. Any other questions or comments? Betty, yes.
When I was working as a substance abuse counselor at a methadone clinic, I was judged harshly by my peers because we blew bubbles. We made raffia baskets. I worked on the B word, bored.
Okay. Okay. Yeah.
So we played a lot of interactive games, and we had a great time learning. And I think that's really important that we forget we can learn and laugh.
Oh, absolutely. Absolutely. We need to, if you're all tight and tense, you can't learn. You got to be able to relax. You got to be able to laugh at yourself and laugh with others if you're struggling at a new skill set. Absolutely. Jacqueline, I see your hand raised.
Yeah, I like how this normalizes a timeline of years instead of like the instant recovery process. Because a lot I find with my peers, they expect change to happen now. And even with myself doing peer support for 10 years, I'm just getting to a stage where I'm finally discovering my own goals and moving forward on a more identified path, an individual path. And so I really like that timeline. It makes it more normal, so to speak, I guess.
Yes. I mean, we put such unrealistic ideas. It's like, oh yeah, 90 days, you should be able to do this and that. No, that's such a short time frame. Absolutely. Any other thoughts or themes that brought to your mind?
I know with the second one, with the realizing one's full potential and stuff, because I've been doing this for a very long time, and I know like the term changed, and I'll probably say this wrong, but I just like how you
I
someone
apologize. Yours was, I didn't hear exactly what you said. Yours got a little glitchy. Does anybody else struggle to hear Joy? Mary, are you still there?
Yes, I am. Joy,
Okay.
you might want to log off and come back on, maybe reboot your computer and your sound will probably be better.
Yeah, okay. I
Um,
thought I had a little anxiety there. I'm like, oh no, I've
Yeah.
lost myself.
I just see the growth in people, and they come out of their shell, and their recovery blossoms, and that's why I love peer support. And I've been doing it for like 15 years. Before it was
Yeah.
even a certification, I was trained back in 2010. So,
Mhm.
and I just love it, and but they're definitely their needs need to be met before they're like they can focus on goals, but you just see how they blossom, and
Yes,
it's just a wonderful process.
yes, and it needs to be a combination of things. You can have a goal even before all your basic needs are met, but you can't ignore getting the basic needs met, and try and have some lofty goal. So,
Yeah, but
all right. Well, our second objective that we're going to be talking about is we're going to learn the stages of change and their importance in the recovery process. And I'm going to do a really deep dive into this, and I hope it's not repetitive. I know you're going to get all these slides because this is something that you can work on for the rest of your career, because there's a lot to the stages of change. They were developed in 1982 by Prakashki and Di Clemente. And they were used to develop an effective behavioral intervention process. And what they stated is change is often accomplished in a combination. You need support and challenges. You can't just have a challenge without other people supporting you. And you can't just have support and somebody put that out on you. So there are 5 stages of change. There's pre-contemplation, contemplation, preparation, action, and maintenance. And we're going to dive into each one of those. Um, so before I tell you the stages of change, why do you think stages of change are important? Gabriella?
I think it's like how to be able to support them through those changes because, like, with every part of the change, like every stage of them, they need support different to get to the next stage.
Yes, that's the perfect word because it's different depending on what stage they're in. Any other comments? Okay, that you hit the nail on the head because if you understand what stage somebody's in, then you're going to be able to identify what the skill set is. It's kind of like if you needed to repair your car and you didn't have the right tools. The other thing is if you know the right stage of change that the person's in, you're going to reduce their resistance immediately because you're not going to be asking them to do things or suggesting things that are out in left field. It's also going to improve your connectedness with them because they're going to realize you get them, you see them, you hear them. You're not just a robot coming in and doing the same thing for everyone. You really have individualized what you want to do. And overall, if you understand the stage of change for your particular person that you're working with, you're going to be able to develop wellness plans and have an overall higher quality of realistic goals and objectives instead of unrealistic or institutionalized ones.
Debbie, there's a few
Yes,
comments in the chat. If you want, I can read them.
I would appreciate that because I can't
Okay.
see all those things all at once.
Okay. So Devin said, knowing where a person is at in the stage to better provide support. And Rachel said it's easier to provide the right support. And
Mhm.
Betty said they can be in more than one stage at the same time.
Yes, particularly in the having two different situations that they're trying to change, and you can be in pre-contemplation one and preparation for the other, or any of those kind of things. So yes, good. So the first stage of change is called pre-contemplation. And pre-contemplation means that I have no intention to change and I don't think I have a problem. Or the person may be unaware that the behavior is a problem or unwilling to do anything about it. So I like to describe when somebody is forced into treatment. We often hear it after somebody's gotten alcohol or drug trouble, and they'll come to treatment and they're like, I don't have a problem with alcohol or meth or fill in the blank. I have a problem with law enforcement, or I have a problem with my wife because she won't do this or that. But they don't identify what the actual behavior is, or they don't see the intensity of the problem. The other part of pre-contemplation is that the person may start to think that there's a little bit of a problem, but they lack the confidence to change that behavior because they previously failed at it. So you can see how if somebody has been depressed, they couldn't figure out the right combination of medicine and people and therapy, that, well, I don't want to try and change because I've always failed in the past. The other part about pre-contemplation is the person tends to view their behavior as more positive than negative. You know, they might start to say, well, there's a little bit of problem, but they still think that there's more reward from that behavior than there is negative. And then the final thing that I characterize pre-contemplation is that the behavior is going to be under control, or at least it's mostly manageable. Even if they're starting to think that there's a problem, well, it's not that bad. I can handle it. You know, I only have gotten 2 problems or whatever. The second stage is contemplation. And these stages people do progress through. They are linear, but you can go back and forth, and you can have a different stage for various problems. So contemplation is the person's considering changing, but they've not yet initiated any behaviors to change. They might be considering the implications, the pros and the cons of what changing a behavior would be. Um, Oftentimes in contemplation, the person is distressed. They are visibly upset by that targeted behavior. You know, they're upset by their anxiety. They're frustrated by their drinking or using. They don't like that they're eating in a binge way, or, you know, name the problem. They're starting to see that the pros are outweighed, the cons are outweighing the pros. Oh yeah, and so the positives are starting to be less and less for them. And then the person in this contemplation stage typically seeks out some information about the behavior. They're starting to read and learn about it. So they're just considering, maybe what if, could it be possible to change? The next stage is preparation. And in preparation, the person has realized that there's a problem and they're ready to change, and they're ready to change both their attitude and their behavior. But they don't know when. They just know soon. You know, maybe by January 1st, I'm going to do X. Or maybe on Tuesday of next week, I'll start getting up a little earlier and showering and taking my medicine. But they're really not very confident in their ability to self-regulate around that specific behavior. But they're preparing to make some changes. Maybe they're writing lists out and saying, well, if I did A, B, and C, then that could work. But what you'll find in preparation is they haven't quite got a stop date. You can hear this a lot in the stop smoking campaigns that are very successful. If somebody's like, I want to stop smoking, we have a lot of literature now where they're like, you need to start preparing to think about it. And preparing could sound like, I'm going to tell my 5 trusted friends that I'm going to stop smoking. And then I'm going to make sure that I have healthy snacks of, celery and carrots to crunch on. And I'm going to go to the store and I'm going to get myself some mints and some toothpicks. And then to avoid that, well, I should change soon, you'll hear in smoking cessation, they'll say, pick a quit date. I'm going to stop on Monday, and it's going to be at 12 noon. Or some people will say, I'm going to stop when I get to the last cigarette in this pack, or I get to the last Juul cartridge. I'm going to stop. So preparation is both attitude and action. And then the action stage of change is exactly what it talks about. The person is actively making behavioral changes. They are working on their attitude and their responses to how that change has happened. And they're learning to prevent reversal in that behavior. Or in addiction work, you talk about avoiding a relapse. In other chronic illnesses, it's stopping the self-destructive behavior sooner than you would have in the past. And this action stage typically lasts on average 6 months when somebody's really trying to change a behavior. We know from the neurobiology of our brains that to change a behavior, you need 90 days at minimum. That's why around the 12-step community, 90 days are so important. Or sometimes with medications, doctors will be like, I'm going to give you a 90-day supply. And I want you to check in with me once every 30 days, because if it was that easy, by 90 days, people should be able to change behaviors. But we know that it's harder than textbook averages. And then the final stage is the maintenance stage. And this is when the person has sustained some strengths around those changes. They've modified their behavior and they're practicing their skills on an ongoing basis. And these new things have become their habits, their rituals that allow them to change that behavior and keep it stopped. Routines and self-accountability become very important in whatever it happens to be, and we've all worked with people that, I always think the person that has a lot of anxiety, it's like, okay, I'm going to be going into a new environment. I need to prepare the day before. I need to make sure that I have the right clothes and they're laid out at night. I need to know that I've looked at the map or the Google map and know how long is it going to take me to get to point A or point B. I need to know that what foods are going to be there. I need to know that I've gotten everything planned, because the routines give them structure in emotions and feeling positive in being able to keep that behavior changed. So that self-accountability is really important in that maintenance stage. Questions, comments before we take our next deeper dive? Just want to make sure I always give you guys a chance. Trying to make sure I find the right slides. Okay, so we're going to keep going then. So common characteristics. If I was in pre-contemplation, oftentimes the person is going to seem defensive and resistant to any change around that from an outside source. This is the yo-yo kind of feeling that we've talked about. They'll say things like, I'm pressured or I'm mandated to seek treatment, or they don't think the problem is as bad as it is. Like, you are very depressed and you've been suicidal, or you are so anxious you're not coming out of your house, or you're not showering anymore. And they're like, it's not that bad. Not that bad, because they're afraid. Contemplation, you're going to see it present like they're very distressed over their behavior. They understand it's a problem. They have a desire to change. but they just can't figure out how to make that happen yet. They also have frequently made attempts to change in the past, and they sometimes have this language of, I'm just a failure. It's not going to work anyhow. I don't need to even think about it, but they think about it all the time, whatever it is. They just don't know what the preparation is. And then preparation, you're going to see the person that's going to engage in behaviors. They're going to be on the verge of taking steps. They're going to have what you would consider a really good plan, but they can't pull the trigger to actually start it, or they can't step on the gas to get going, because they just think, well, I got to think through a little bit more. I just got to do a little bit more. And so you can find that breaking it into baby steps is something that would be even more helpful for somebody in preparation stage of change. And then the action stage, what's going to be characterized is they've decided to change. Their environment has begun to change around them and with them also. That's one of the things that I like to see. Oftentimes people start to simplify things, and they're really willing to hear suggestions at that action stage. Like, what's worked for you? Tell me more about that. Somebody that's in the highly motivated action stage, I find, is very enjoyable to work with, because they're just like a big sponge, checking it all off and saying, oh, I'm going to do that and that. And sometimes you have to slow that person down, because they will overwhelm themselves with all the suggestions that everybody's given them, and they will try too much, and they'll get too tired by trying to change everything all at once. And then the maintenance stage is characterized by the person that's really doing sustaining talk. Like, they're not afraid, and they may have some anxiety or some fear that the other behaviors will come back, but they've got skills under their belt that they are saying, oh, I'm going into a higher risk situation, but I know I need to bring a friend, or I know I need to make sure that I have more rest before this happens, or I need to have a downtime in between stressful activities, so that they can reset their neurobiology or whatever. So, questions, comments? Okay. So what we've learned so far is that people present in various stages of change, and therefore the tasks that we need to do for that person are varied, and that as a coach or a peer specialist, we need to figure out, how do we determine who's in what stage, and how do we determine when people are moving back and forth into a stage. Because if we're moving too fast, we will lose them. So what I find is that most people that are in treatment are going to be in pre-contemplation, contemplation, or preparation. That is the type of clients that we're going to get. Would you guys agree with that? That a lot of times people aren't in action stage, or they probably wouldn't need us. Silence always means yes, right?
I have a question from your comment
Yes.
you just made. There would be like in 1, pre-contemplation, 2, contemplation, or 3, preparation. And I have a client who has co-occurring disorders, and
Mhm.
she's doing the steps into action, she's almost 90 days.
Mhm.
So I got kind of confused on just what you just said. There,
So you see she's in the action stage of change?
yes, because she has stopped using. She's going to be 90 days. She's probably
Mhm.
90 days when I see her. But there
Okay.
is one problem with the change. Her boyfriend's in jail. She's ready to, and she has mental health help,
Mhm.
but she's homeless. So she has to stay
Mhm.
with people who use. So she
Mm.
spends most of her time at the office. She does her homework, and she talks with the different counselors different people
Mhm.
she's working with. She's got like 5 different people she's working with.
Mhm.
And I look at her as still a high risk to
Mhm.
relapse because of her environment,
Mhm.
doing all the other, everything else the right way. When they are looking for her to get to look for a place, but once she has no income,
Mhm.
she's caught in the middle of trying to get on Social Security disability.
Mhm.
And
So, go ahead.
I just get stuck when, when I do remind her that she's still in a high risk environment.
So the way you describe this person, I hear her being in the action stage of stopping using her substances, but I
Mhm.
hear her in the maybe contemplation stage of, is housing important? Or what, maybe she's not even in the preparation stage of housing yet. If she's comfortable being couch surfing with different people, or she feels like there's no other option except for to stay in this house where people are using, that's probably pre-contemplation on, does she have the skills or ability to find housing? Or does she want to go into a sober house where she doesn't know people? So that's a perfect example where you can be in two different stages at the same time. And when somebody's like, hey, we want you to find housing, it's overwhelming for her. So you have to break that part down into really small parts. And, in the contemplation stage, it could sound like, do you think you'll ever find housing? Well, if she says no, I've never lived on my own in a safe place, you know that you have a bigger leap than, well, yeah, I know there are opportunities. I know I could do this or that. I just don't know how to get there. And then you can help her break it down into pieces. And celebrating all the positive work she's doing on staying sober, and the homework she's doing, and coming to the office and staying in a safe place. So great example. Yeah.
Thank you.
So Debbie, there's a
Yes.
comment and it's from Molly. I work with a lot of people who are in drug court, and from my experience, they are in those three stages the first year, but as they get closer to graduation, they move into that action stage.
I would agree. Our drug courts are designed into helping people with that reward, and accountability. So I agree with that. I've seen that happen a lot. Lucia, I see your hand raised.
Yeah, so when I've looked at these before, I mean, it was a while ago, but they talk about, I had seen some things online that they have relapse as part of those like stages of change. Is that like, have you seen that? Is that something that's like an unofficial added part of the stages of change?
So relapse does not have to be a part of the stages of change. And I choose not to teach that one because my own experience is that we are all progressing and relapsing all the time in substances, or in action, because nobody can sustain anything always and forever. And when I think of relapse, we typically think a return to substances or a relapse where you've stopped your mental health medications. I think it's just people that have come out of action stage back into something else. So there are some people that think relapse is one, but to me, it's relapse can happen anywhere. You can
Yeah.
relapse on your physical health by not sleeping enough, or not getting physical activity, and then your mental health starts to slide back, and then you think, well, life's not good anymore.
Yeah, no, I love that. Thank you.
You're welcome. Any other comments or questions?
Yeah, because I've known, because like I said, I've been doing this for a long time. Even medication can quit, like mental health medication can stop working. And
Absolutely.
so, yeah, like, so,
And then you have to go back and have some and it's not action stage then, it's almost preparation again, where you have to prepare to go in and have a conversation with your prescriber of like, I think something's not working with my medications, and then preparing to change a medication and monitoring, is it better or worse, and getting feedback from trusted people. And yeah. And so some people could say, well, you relapse because your medicine stopped working for you. But some of that language can be harmful instead of helpful.
Yeah.
So the next thing I want to do is I want to kind of share with you some of the things, and these are takeaways that you can take with you, is in pre-contemplation, the things that the individual might be doing, and then what you as a coach or a peer support should be doing or could be doing. So in the pre-contemplation stage, we know that they don't really think there's a problem, or maybe they recognize that there's a little harmfulness, but they don't know what to do. But the role of a coach when somebody doesn't think there's a problem is you just kind of raise some doubt in a non-judgmental way and say, well, if you're, and you have to know the person over time. So I'll use the example of like, maybe you're working with somebody and they've got a great relationship with their brother. And so you kind of take it away and you go like, you don't think that's a problem, but man, if your brother was doing that, what would you think? And you can just raise some subtle doubts. You can increase your concern or awareness. You just kind of share little things like, if your brother was doing that, would you be concerned about him? And then the other part of pre-contemplation, because in pre-contemplation, the person doesn't think that they're capable, is you give hopefulness language and optimism, that it doesn't matter how long you've been doing something, there's always the ability to change. There is always something that can be different. You become their cheerleader, giving them opportunities to see themselves through your eyes. And to stay in this field, being a recovery coach or a peer specialist, you need to have a lens of optimism, not a lens of criticalness or judgment. When you get into the contemplation stage, this is where they're starting to see a problem. They're saying they want to commit to do something different. They're wanting to take some sort of a first step, possibly. And they're saying, okay, I'm ready. I want to resolve this. The coach at this point needs to kind of have a microscope where you begin to examine the impact of the problem, almost like you've taken the problem out of them, you put it onto the lab desk, and you're like, let's kind of pick this apart. If you decide to stop this behavior, what are the good things that can happen? The good old pro and con list, and really give them some decisional balance points of, I would be really in favor of doing that, but also equally, if they're like, man, but if I stop doing this, I'm not going to have my best friend any longer. And you acknowledge the things that they see are going to be a hard part. And again, you reinforce the optimism that change is possible. And you reinforce that you understand that they're ambivalent, they're going to be giving up some things that they still like and enjoy to get rid of those negative things and those hurtful things. And so sometimes people will talk about, you gotta break up with the old behaviors that were working with you. If you've talked to anybody that's done 12-step recovery for a long time, that they'll talk about, you gotta break up with all those old behaviors and figure out what's going to work for you in the good sense, and do a grieving process. Questions or comments about your role as peer support during contemplation?
There is a comment from Betty from a little bit before, and well, not
Okay.
much before. The nicest thing clients told me was that I held hope for them until they could hold it themselves.
Absolutely, Betty. Absolutely. And that goes for any of us. If somebody sees potential in you, that is amazing. You know, we know one of the protective factors for young people is if you have one trusted adult that sees your potential. You know, your whole life can be struggle, but you know, the ACEs scores say if we have somebody that's holding hope for us, that goes a long, long way. In the preparation stage of change, the person themselves is starting to establish some priorities. They're starting to write goals. Oftentimes, they're making a plan. And when people start to turn this light switch on, they oftentimes overwhelm themselves and they start making too many lists and too many plans. And, you know, I was talking with somebody earlier today and they're like, my person has just gotten over a medical crisis and they're going to buy a car and a house and a puppy and it's like, slow it down a little bit. Let's slow it down. So the goal in preparation for the recovery coach or the peer support is you strengthen their commitment to that change. You reinforce over and over how proud you are that they're making that change, but you help them to develop an action plan that is achievable, and you help them with strategies that will get them into little steps of success, not that big leap. Because if they go the big leap and there's too much of a landing zone and they fall flat, then it's really, really hard to get back up at times. So you're trying to be the safety net and make stepping stones along the way in their preparation. It's also important that this is when you really need to know a lot of your community resources for housing and transportation and who's got open appointments for medications and who's got a physical health appointments at a clinic, because there's lots of things that'll be barriers and you are helping them get little steps to establish that success. When we get to the action stage, earlier we were talking about the client that's in the action stage. They are applying their changes. They are the ones that are really excited about things. And the coach's role is to support that ongoing implementation and help them develop the new behaviors. You know, asking them things about how their attitude and their feelings are working and seeing if that's conducive with the change. Because oftentimes in the action stage, and people will get emotionally overwhelmed, like everything's going really, really well. And this self-doubt will happen where they're like, life's too good to be true. And they can actually self-sabotage because the little messages in their head has been, well, you've never done it for this long. And we know people that will self-sabotage, you know, post-acute withdrawal will happen, or, you know, I got 6 months down the road and I can't continue doing what I'm doing because I don't know how to feel happy all the time, or I don't know how to feel content. So helping people with their attitudes and the warning signs. I like to pull the statement of HALT out of the 12 steps of Alcoholics Anonymous. Don't get too hungry, angry, lonely, or tired, because that's what can happen when you're sustaining action, action, action. People forget to rest and do self-care. And so your wellness plans oftentimes are things that, you know, keep doing all those great things. You know, you're working through drug court and you've got your job and you're figuring out your finances and you're staying compliant with your medication, but it's okay in this stage to have little built-in rest periods and self-care times. And then maintenance is when the person really has developed their routines, their rituals, their accountabilities. They're really aware of the positives associated with the change. They're feeling better. Their friends are back. Their gratitude is high. And your job as a coach is really to celebrate it over and over, you know, reinforce the positive changes, encourage. That's why having people in various stages of changes is wonderful, because this is when connecting somebody that's been in a struggle with a new person, because you can notice the progress and then say, to this person in preparation or the beginning stages of action, look, this person's been where you were and the quality of life has gone up, and sometimes you can help them with their next goals in this particular stage of change. Oftentimes people, by the time they get to maintenance, they've dropped out or their funding has run out and you're not really working with them anymore. Any questions? Trying to watch our time.
There is a comment in the chat.
Okay.
Sandra says, when someone tells me that they are not ready to stop, I always point out to them that I really appreciate their honesty and still coming into group. I say to them, I hope that you hear something that will help you when you are ready. I feel that by just coming to group, they are taking some sort of action towards wanting recovery.
Absolutely, because it's effort to come to group, even if they're externally motivated because somebody told them they had to. We know people that don't choose to, and they end up with legal problems or unfortunately no longer alive. So the fact that they're coming to group, they're getting something. They're getting something out of it. So I really appreciate you acknowledging that ambivalence for them. And it's okay to be ambivalent. So what we know is that there has to be varied approaches to helping people because people are moving through recovery in a lifelong process. Not any of us have just one problem or identified need that we're trying to change. All of us, even in our most healthy wellness, we're trying to do multiple things at a time. So we could be in pre-contemplation for one thing, giving up donuts, and be in the action stage of putting our shoes on every day, and be in the maintenance stage of brushing our teeth. That's good. So it's all those different things, and realizing that what we need to do is be able to provide some motivation and know the language to talk to people. So the next objective is, how do we talk to people in various stages of change? And I described this as identifying ways to roll with resistance, because as I shared at the beginning, if we push too hard, people will push back. It's just human nature. We are autonomous individuals and we don't like to be told what to do, whether we are 3 years old, 13, 16, or 60. We like to be our own and to be partnered for it. So Di Clemente, they described that once you know the stages of change, then what you have to do is know the motivational interviewing, and you can get a master's degree in motivational interviewing, but everybody should understand the spirit behind motivational interviewing. And I'm not so hung up on, are you doing it exactly perfect? But if I can give you some skills to walk away with today, every conversation that you have, whether it's with your client, your supervisor, or your best friend, will be more productive. Because if you're using motivational interviewing, it's a collaborative approach where you're having a give and take dialogue instead of it being an authoritarian or a confrontational approach where you're telling somebody what to do. It's also where you're evoking something, you're eliciting a response, and you're trying to see, am I getting to know you? There's a lot of curiosity to the way you ask questions instead of saying, do this, don't do that, in an educational, lecturing, teaching kind of way. And the other thing that you do is you give the person or the client their autonomy. You're not the authority figure over them. You're not their PO, you're not their boss, you're not their mother. You are somebody that's coming alongside and walking step to step with them and looking at them like you would your best friend and saying, gosh, I'm a little concerned about you because of A, B, or C. Or I am so proud of you and excited for you because of. but you're always going to give them their ability to be their choices and their autonomy, because you know that you can't control anything that they're doing anyhow. All you can do is be a mirror and hold it up. So the keys to motivational interviewing, I'm going to try and take like the next 20 minutes and give you as much as I can. And Mary, watch the comments if people want to stop and ask. But the keys to motivational interviewing is that it should be multidimensional. You're not just focusing on one topic, you are asking for what's the attitude around things? What are the fears around things? What are the concerns that they have? And that you're trying to influence the interaction by how you're talking to the person. It's very circular in a conversation instead of, I want you to get from point A to point B. I'm worried about you. You seem depressed. You're not showering and taking your meds. So I want you to shower and take your meds every day. That's a very linear approach versus what's going on with your medications. Are you having any side effects? When's the last time that you think they were working for you? Why did you think that it was not good to take them anymore? You're just kind of doing this circular kind of thing around and round. You know, what's the good things about not taking your medication? If you were trying to only get them to take their meds, you would never ask them about why it's good not to take their meds. So you're trying to just get as much information from a person in a motivational interviewing way so that when you start to come up with goals, you know that person and you know what their desires are. So in order to be creating a good wellness plan, we have to be able to ask really good questions, and we have to be able to express our empathy, which is different than sympathy. Empathy is being able to come right alongside that person and hear, man, this is a tough spot for you right now. This is a hard day right now, versus a lofty down approach where I'm kind of sitting on my pedestal saying, oh man, you're really messed up right now, or you're really having a hard time right now, in a downward kind of way, versus I'm here with you in this hard time. How can I support? You have to develop some discrepancy between what they want and what might be in their best interest without avoiding this arguing about it, versus just being able to say, have you ever thought of doing something different? When's the last time you've thought of doing something different? And supporting self-efficacy, that it's their choice no matter what. And you can say, like, my preference for you, my hopefulness for you would be to take your medications and shower every day. But if you choose not to, I'm still going to care about you and I'm still going to be here to support you.
Debbie, there is one
Yes.
comment from Molly.
Okay.
I
Okay.
gently ask my peers what their alternatives are. I find this gets them thinking about the other options they have and then allows them to select the one that is usually going to be the best for them.
Mm-hmm. Absolutely. Absolutely. That is what I call the pulling language. Instead of you pushing them to make a choice, you're pulling them into a thinking process. Mm-hmm. I'm going to kind of talk about the bottom of the slide first, since we were just saying that you're helping that person recognize their strengths and bring it to the forefront of what their choices are so that they can make small choices and small steps towards it, instead of you trying to tell them what's happening. You also want to create a safe environment where you communicate with that person in a non-judgmental way, that it's their choice and that you are there to be a knowledge consultant, a knowledge coach, but that you're not there to tell them which choice is better. But if we're going to serve them things, you're going to serve them positive choices and neutral choices. And then you're going to say, well, we're also going to talk about this negative choice, but I really want you to put it over here on the side and see if you can choose any of these other ones. And that's where you magnify the ambivalence for the person. If you've given them a lot of positive opportunities for future hopefulness, it's harder not to think, well, I can't do that. Well, yeah, you can, because I've just given you 10 opportunities to be successful. And it makes the landing or the stepping off easier for them. It's really important when you're working with people to avoid arguments or power struggles. If you start to see any signs of the person being argumentative, you know that you've pushed too far, you've put too many of your own personal goals there, and that you need to take a step back and take that as a signal that their resistance is too high for the step that you are suggesting for them, if that makes sense. The other thing when we're doing motivational interviewing and the change process is one approach does not work for everyone. And the other thing that we think about is, well, this used to be working for that person, but the same approach will stop working at times. I think somebody earlier referenced that at times people are doing great and then things will stop working, whether it's the medication will stop working, somebody in the social circle will have a struggle. So the approach has to change, even if it had been working. The same person might be needing a different approach along the way. So you have to be adaptable and resilient so that the person can realize that they can change and be successful. And you are an endless bounty of brainstorming. And that's where, when you lose your resiliency or the idea, that's where you go to the other peers that you have and be like, okay, I need to consult on this case. This is where we kind of hit a roadblock. What are some more ideas? What are some more resources? Being able to go to your supervisor and present and be like, okay, I'm losing my hopefulness. I'm stuck, because we can't present that to the client because they are already feeling stuck when they hit those hard spots. You also need to listen for the language that you're going too fast. And I have a whole slide that will give you some of the words that might pop out of the person's mouth. But I'm curious if anybody can hear a client in their mind and share what are the types of things that people say to us that trigger us to know or remind us that we've moved too fast. Jacqueline, I see your hand.
An example with motivational interviewing, for instance, a client was really struggling with making changes and being willing to even want to acknowledge some of her anxiety, where it was coming from. And her phrase was that she didn't understand what the question was, even. You know, that they're not ready to make the change when they can't even comprehend what the question is. When you're asking, what is it that why are you afraid of jumping off of that diving board? I don't understand what that question is. You know, yeah, that was a specific incident that actually did happen.
Oh yeah, that's a perfect example when they've gotten so overwhelmed that you think it's a simple question and they're like, I don't understand. I don't get you. I don't understand. And you're like, what? You've pushed a little too hard. Yeah. Rochelle, see your hand raised?
Yeah, I have a client in particular that will start talking about a lot of overwhelming like need to do or doctor's appointments and such. And so when I try to engage in like asking open-ended questions or asking like, hey, would you like any tools to assist with this? Immediately the specific client gets triggered and they go into a very dismissive, or they'll say like, no, I don't want to. And it's kind of a normal behavior with this specific client to be totally against any type of skill or tool. So we have to do reframe a lot, or I'll kind of recognize behavior. I'm like, okay, maybe this is just, I want to talk, I don't really want any type of tool. I just need to verbally process this and such. But we also do a lot of refrain. But I do notice and other clients that I have too, is their quick need to backpedal or
Mm,
feel like whatever options I'm able to give them, they're not able to follow through with.
hmm. Yeah, yeah, that's a good example. Anyone else?
Debbie, there's a couple of comments in the chat.
Mhm.
Sandra says just body posture when they sit back and kind of shut down.
Mhm.
And Molly says when they continue to change the focus of the conversation every time you bring the specific change up.
Mhm. Mhm. Perfect examples. Mhm.
And Mikhail says victim stance, unwilling to be accountable for their actions and blaming others for current situations.
Mhm.
And Veronica said absolute silence.
Mhm. They just shut down. Absolutely. So you've hit a lot of these, but there really are four types of resistance. There's that arguing where the person starts to be directly hostile. They're discounted by any of your questioning. They discount your expertise. You don't know me. You can't help me. They challenge the accuracy of what you're saying. They're like, you don't really get me. So there's that arguing part. There's the person that when you get a little bit too much, they interrupt you, they talk over you, they cut you off. There's the person that is doing the denying. They're blaming other people. They're disagreeing. They're making excuses. They're minimizing. They're reluctant about the information or the advice. They're just not accepting anything. And then the last one is the ignoring behaviors, the inattentiveness, the non-answer. They'll respond to the question and answer what you didn't ask. They'll change the subject on you. They'll start telling stories and go back to, well, 4 years ago this happened, and ultimately the ultimate ignoring is that complete shutdown where they just kind of like, I'm done, I'm not talking to you anymore. So what we know is when those type of things happen is we are moving faster than they are able to process their, not that they can't change, but their theme in their head is, I can't do this. I can't do this. And the anxiety goes up. And so that's where a lot of this resistance comes from, is the stories that people tell themselves. Um, and people will say very powerful and very inertia creating statements. And that's what they're hearing in their head when you're like, oh, we can do A and B and C. And they're like, no, I can't. I always disappoint everyone. That's not going to work for me. I can't do that. Or I never stick with anything. Or it isn't that bad. I don't know why I have to change all these things, because their brain starts to play tricks on them and be like, well, it's not that bad. I'll just stay right here because I'm afraid that I'll fail if I step forward, and I don't want to go back there. So I'm just going to stay right here where I'm at. I don't want to change. Just like a little mouse that gets scared is like, I'm going to hunker down right here. um, I'm okay this way is another way somebody might say that same thing, is it's not that bad, or I'm okay the way I am. It's not super duper, but it's not terrible and awful. But I don't know what the future is going to hold. So my uncomfortableness in this moment is better than my fear of what might happen. Um, a little longer this way won't hurt. I can change tomorrow, and tomorrow never comes. But those are the things that people are saying in their head. So being able to have open, honest questions where you say to the person, gosh, is are you thinking that it's just kind of okay to stay the way you are right now? Like, and or saying, man, this is a time where it'd be typical for you to think, I'll just stay right here. Or I've heard you in the past say you're a little afraid of change because you might disappoint people. A little, I'm afraid of disappointing everyone. And it just changes that tone where you can give them some hopefulness of, it's okay to feel scared right now. It's okay to think you're going to disappoint people. But it's not going to be the end of the world, that kind of thing. So some key questions that you can ask in times when the person's starting to get resistant is, what do you think you will do to change? So it's like, what do you think you're going to do? Or if the person seems uncomfortable, it must be uncomfortable right now. What's your next step? What's your next move? And then you can follow that up with, and how would you like me to be involved in that? You know, do you need a resistance or resource? Do you need me to just listen to you vent? Do we need to go and write a list together? It gives opportunities for their autonomy. You could ask them questions like, what do you think has to change? Because they're the expert in what their mind's telling them, what their behavior is doing. But you're the expert in hopefulness. So, you know, what do you think has to change? And they might give you a little inkling of something, and then you just magnify it and you grow it. And then it gives them some more ideas, and you've created more forks in the road. You can ask them what's their options. And if they think, well, if they come up with one option, you can come up with 3 or 4 more. Or if they come up with 10 options, you might go, oh, we need to narrow down the options versus expand the options. You could ask questions to reduce the resistance on, like, how are you going to do that? Like, how are you going to do that? And then you can be that trusted confidant, or, you know, if you can say to your best friend, like, that doesn't make any sense. You've missed a couple steps there. If we were building a rocket ship, ours would blow up and it wouldn't make it to Mars. We got to back up here a little bit and put some more meat on the bones. You can ask questions about, when are they going to do something? So how are you going to do it? When are you going to do it? And what would be some of the good things about doing that particular change? All of that takes the resistance and gives them the opportunity to have some autonomy around their choices. Comments, questions? Okay. When you're trying to build the change talk and pull people into conversations, pulling is better than pushing. And what I mean by that is having them focus on meaningful events that they want to accomplish and try and associate that with something that has been pleasant or neutral from their past. Because if we try and make a leap from a terrible, awful thing into something fantastic, it's often hard because we don't think that we're going to be able to accomplish that. But if you can parallel, even in a hard time, what was a pleasant experience or who was a pleasant person around it, it's more likely that our brains can make that kind of a leap. So it can sound more like, what do you want more of than you currently have or you're currently doing? And that's just enough to say, I can put a little more effort in. If I did X and Y, I can have more connection with my mother, or I could have more comfort with the way I manage my medications, or I can have more positive thoughts instead of negative thoughts. Questions? I know I'm just going. We're doing fine though. The other part around change talk is to make sure that your questions are open-ended. When you get really good at motivational interviewing, you try and never ask a question that has a yes or a no answer. You try to ask questions that will always invite the person to elaborate on something. It will help them plan for their future. Like, what would you like more of versus less of? Which is different than if I'd say, gosh, don't you want to be out of trouble more? Well, yeah. And it ends the conversation. Affirmations in the change talk, you have to sandwich in. We are self-critical so much that you need to have an arsenal. And sometimes when you're working with somebody that you are struggling with, pause before you go to meet with that person and really think, what are their strengths? I need to have some language around their strengths. I need to really make sure I can describe their abilities or their efforts. Even if it's a very small effort, you need to find what it is so that when they're struggling, you've got the positive mirror that you're holding up in front of them instead of kind of stammering and be like, oh, shoot, I can't think of what was good or what was happening. Go in prepared to be able to help deepen those conversations and counterbalance their negative self-talk. The other thing is being able to summarize and reflect as you get to know a client from session to session. Some people have the opportunity to work with their mental health clients over years, even being able to have this sense of a bigger picture and a larger sense instead of trying to get from just point A to B. You have some history and being able to share, well, what was going well in a particular time, or what were you doing differently? Who were you hanging out with differently? All helps with that change talk into a positive connection instead of a negative connection. Miriam's going to keep going unless you say there's questions. And again, you can see these all in the slides, but there's other ways in the change talk of, if you're trying to help somebody see that they have some abilities that they're not aware of, you can do things like, what do you think you might do to change? Or how confident do you feel like you are to do X, Y, or Z? Which is different than, do you think you can do this? It's how confident. That's the ruler approach on a scale of 1 to 10, 1 being the least confident, 10 being the most confident. You can gauge things in how badly do they want some, what's the desire to change. You can ask questions along like, how would you like your life to be different? And you can give them things like, in a month from now, what would you like to be different? You can go like, in 2 months from now, what would you like to be different? We could go back to the conversation that we had, the example earlier in the session where the person was not very confident in housing potentially. It's like, well, what would you like to see different in a month from now? Well, I would like to be sleeping in a house where there aren't drug using people. Okay. What would you like to see different if they said, I want to own my own house in a month? You can see where you have to help them with their goals differently based on what they're saying. Because if they're like, I just want to be sleeping where there's people that aren't using, well, we can look at sober housing. We can look at what the resources are versus I want to buy my own house in a month. Well, got to get the job first. You've got to do some other things. The commitment to change is one that we all can struggle with, but helping them identify how committed they are to change is important. So you can ask things by asking them to identify specific things they're willing to do. Like, what are you willing to give up? You hear this in the 12-step language where it's like, I'm willing to go to all ends and all means to make this happen. Like, I'm willing to give up certain things and certain people. You can ask them to rate things on how confident they are, how important it is to them to just figure out the desire, because we don't have to have the same commitment on everything. You know, you might be committed to saying, well, I want to eat healthier, or I want to brush my teeth at night before I go to bed. Well, I'm not very committed to that because I don't have any sore teeth and the dentist says I don't have any problems, versus somebody that's like, oh, you've got receding gums and the dentist says you're going to lose your teeth if you don't do that. Then the desire and the commitment to do something is based on a different approach. So if you are doing motivational interviewing based on the stages of change, we sometimes wonder, am I doing this right? How am I going to know if I've figured out what the stage of change is for the client? And am I asking them hopefulness questions that are going to help them magnify their efforts? You will find that you do more listening than talking. You're going to be successful in asking a question, and it's going to elude them to start talking. You're going to find that you are sensitive and open to their issues, whatever it may be. Even if they're talking about things that you think are possibly not in their best interest, you're not going to shut them down because you're trying to hear what's the history behind it, what's the negative self-talk. You're trying to be curious in everything. You'll know that you're doing it right if you ask to give permission to give them feedback instead of finding yourself saying more an authoritarian process versus, hey, can I share with you my thoughts on this? And you're asking permission instead of just jumping in. If you're listening to understand the person instead of listening to tell them what you think that they should be doing. If you find that you can summarize back to them what they've said in a nice narrative summary at the end of a session, then you know that you've been listening for their change talk instead of your agenda. And you know that you're doing it right if you can remind yourself that this person is capable of changing and making their own choices, no matter what. Then you know that you've been able to give them the authority and the autonomy. A couple of things that I'll share before we get into the wellness plan is don't be afraid of the resistance, just don't fight it, just acknowledge it, understand that it's part of the process, and realize that you might need to meet with the person multiple times to get through something, that it's part of the process. It's not something that you should avoid. It actually will help them get better. So our last goal of the day is, how do you take all of this knowledge and turn it into a recovery plan that's actually going to help create change instead of just creating compliance with a funding source? Because sometimes we do paperwork just because we have to versus it's useful. A good recovery plan is individualized to that person. It is not a cookie cutter. It's not something that you've already written before you get with the client. And it probably needs to be developed over several sessions. And I do want to say that every agency, every funding source does have their own format, their own compliance. I'm just sharing one that has a lot of the components. But this is not any one thing that's like, oh, if you do this one, you'll always get everything right for your funding source. So make sure you look at your own agency or your supervisors of what they want. But when I think of a wellness plan, I think of a wellness plan of having 7 parts. There's a social aspect to it, like what's the connectedness to other people and the recovery community, and that is broad and wide. There's a physical health component to it. There's an emotional or a psychological component. There's a spiritual wellness part. There's their living and their environment. There's an occupational or an educational component and a personal daily living, eating, working. And you could have a goal in every single one of those areas, but I highly encourage you not because it would be too overwhelming. But it's a good framework to think of, depending on the stage of the person's recovery, they could have multiple goals in any of these areas. It's best if the person keeps it and maintains it. It's best if you break it into parts of like 1, 2, or 3 goals. If you get more than 3 goals, it typically is something that it's too overwhelming if we're trying to change that many things all at once. And a good wellness plan needs to be looked at every 30 days. The objectives and things can be session to session, but to just pause every 30 days and think, is this really the goal that we still should be accomplishing? Many of you probably already know the SMART goals. They need to be specific, measurable, achievable, relevant, and time-bound. For time's sake, I will not go into that any further, but to meet funding sources, you need to make sure they're SMART goals. And what I find is if the person is creating the wellness plan with you, there's the broad, overwhelming goal. And that is a good stopping or starting spot of what is your overall, I want to feel less depressed, or I want to take my medication as prescribed, or I want to find housing that's so safe and sober. And then you would have a goal that you would put into that plan. And the goal can be varied depending on if it is, I want to take my medications as prescribed. Well, somebody's goal could be that I want to put my medication set together every 10 days, keep it in the cupboard by my toothbrush so that I'm more likely to take it. Somebody else's goal could be that I need the funding or I need to find the prescriber that'll prescribe my medication because I don't even have it yet. So the goal itself will be changing based on what steps do they need to do to take that plan, and then what people or resources, because that's where you as a peer support or recovery coach, what resources might be helpful. That's where your expertise and guidance, and sometimes you are that person, but oftentimes you're connecting them with the people in their social support, their treatment community, because the goal is you're trying to work yourself out of a job, not become the person that is the treatment plan and that you are then they're dependent upon you. And then the next question is, when do I want to have this goal accomplished? That helps you with the measurable aspect of it. So how do you go about picking the goal? You could have one goal under each thing, but I start by brainstorming questions with the person. All the things that you've already talked about is assisting them to come up with what do you want to do. So, for example, if there's a need for connectedness into a recovery community, you help them pick a goal by having some of the following questions. Like, do you have contact with people on a regular basis in recovery? Do you have enough people in your life? And that could help them like narrow down. Or are you involved in a support group? Or are you attending a support group? Am I doing or having a faith-based community if I want to be involved in a faith-based community? Do I spend time with other people and doing wellness things like a hobby? So if you are identifying or they don't know exactly how to pick a goal, I have created for you questions that will help you come up with things. If they're struggling maybe in the wellness activities, like, do you regularly exercise? Do you feel better when you exercise? When's the last time you ever exercised? Do you get enough sleep? Do you need to find a doctor because you don't have medications? These questions can help you over and over come up with how to ask, is there a category, is there a goal in this category that the person might be needing to create? The other question that I like and I put into every one of these is, what other questions should I be asking myself about this category? Because we don't know what their worry or anxiety is. Physical health, oftentimes you'll find people have a lot of questions around past sexual behaviors or sexual traumas. They might be worried about illness and disease and they're not really comfortable. So you can put a question in that just makes it routine. Like, there's no judgment to this question. I ask it to everyone. Do you have any concerns in this area? In emotional well-being, do I work at being in a healthy relationship? Do I want to be in a relationship? Am I seeing a therapist or counselor, or do I need to find one? Do their healthcare providers really understand recovery? Sometimes people are like, I want to change prescribers because I don't think that they understand what's going on. Well, it might be that you need to help them formulate some questions that they go into their prescriber and ask some more questions about side effects or other options. Spiritual wellness, that, are they comfortable with their spirituality? Do they want to develop a spiritual practice, or do they already have a spiritual practice? Do they take time for prayer, meditation, personal reflection? Those are very open-ended questions that can help you ask them things that can come up with a goal in that area. Living accommodations is probably a really easy one, but does where you live work to support your well-being, or do you need to make any changes in your living situation? Is an easier category, not necessarily to find the resource, but people are willing to talk about it and they know whether they have a struggle. Occupational is oftentimes one that people want to work on. Do I have a job? Do I need a job? Does the job support wellness? Does it support recovery if you're coming up with an environment where people are using? Do I need to return to some form of education or skill building? Do I need training in any particular area? And then the personal living management part, you can ask questions along the ways of, do you manage your money? Do you need, or do you know how to use or balance a checkbook? If you have credit, do you manage it appropriately? Can you pay your bills on time? There's things that we take for granted sometimes that people are like, man, I've come from generations of dysregulated people that we don't know what to do, and the life skills that we need to teach around money and money management. You can ask things like, is your living environment clean and safe? Sometimes people need to declutter, when you've been through mental illness and addiction, and sometimes material things become very important because you've lost things multiple times, and so they maybe need to have some organizational things. And so a question around, like, can you manage your belongings effectively? Because I can't really think because my world is so cluttered up. So when I think about this, is there any questions about wellness and recovery plan development that you would like to ask, or have you seen, Mary?
I don't see any in the chat.
Okay. Well, I would like to take the next 5 minutes and give you a bonus goal or objective. I believe every single recovery coach and peer specialist should create their own professional development plan. And that self-assessment can be very, very powerful. And I would like each of you to think of these questions from your own personal management life. Are you a motivator and encourager? Do you believe in the capacity of your clients to change? And you can scale, like very strong as a 10 and less strong as a 1. And you can range yourself anywhere. Are you an ally and trustworthy to your clients? Are you stable and consistent? Are you a good active listener? Are you a role model and a motivator? Can you provide stage appropriate information so that you're really helping them with the stage of change that they're at? Do you find yourself being a problem solver? Do you have the resources to help them with options? And you don't tell people what to do, but you give options and choices. Are you a real resource broker? And I call it a real resource broker because some people know how to navigate systems and know the system of care, and they give real, useful, efficient ways for people to navigate our complicated systems. And others just are great at handing out phone numbers and saying, go over there. But, evaluate yourself on, do you have real resources? Are you an advocate? Will you assist and protect their rights? Do you help them with access to services? Are you a lifestyle consultant? Do you ask things like, how is that working for you? And discussing healthy choices. And the last question I always ask is, are you staying in your role with your ethics and boundaries? And I heard many of you just took an ethics course earlier today. And I don't want you to answer any of these things. What I'd ask for you to do is think about those. And is there more knowledge or skills that you need a gap to fill? Is there an immediate action that you're like, oh man, this stirred up some things that I need to think about? And if so, take out a piece of paper, make yourself 2 columns and say, here's some knowledge and skill gap that I need to fill in. Here's some immediate things I need to do. And take that to your next supervision session, or take it to the next collaborative that you have with your peers, and make yourself an action plan so that you can be the best peer specialist recovery coach that you can possibly be. And here's some resources that you can have. And I thank you for spending this afternoon with me. And I think that leaves us time for a couple of questions if there's anything that anybody would like to have.
Are we gonna get the slides?
I did. I sent them to Mary, so she could probably answer that question of how you get them.
You'll be getting the slides, and we can put them in the chat right now, but I will be sending you an email with the survey link in it, and it will have the slides link in it also.
Cool. Thank you. It was a great
And
presentation.
well, thank you, Joy. And I'm open for any feedback. If there's anything that you want to share on your survey, Mary will blind it out and send it to me.
I sure will.
Thank you so much.
Debbie, I just wanted to say, as a client of the Walker Center and going through this with you, it has just been amazing. Thank you so much.
You're welcome, Brandy.
Jacqueline has a comment. She says, thank you. Courses like yours are always so helpful. Hey, they are a great way to help move past barriers when I have run out of my own ideas or those of other providers and friends when working with others.
Thank you.
Well, thank you, Debbie. That was a wonderful presentation full of so much information. So it'll be really good to have these slides to refer back to.
There's a lot of information there.
Yes, there is. So Rochelle said, I love this class, one of the best ones I've had.
Thank you.
So everyone, I'll send you an email within the next half hour with the survey link and the links from the session, including the link to the slides. And remember that you can check your confirmation or reminder email for the full CEU requirements. You're going to have two days. So Thursday at 5 o'clock is when the survey is going to close. And you can redo it as many times as you need to get your 2 out of 3 questions correct. And if you have any questions, oh, I see Eden put the slides link in the chat. And if Eden, you'd slip our email in there, she just did that. So if you have any questions, direct them to that Empower Idaho email. And the slides and recording will be available on the website in a couple of days. Thank you all for attending. And Debbie talked a lot about resources. Don't forget our session on Thursday on resources. It's really going to be a great one also. So thanks again, everybody, and we'll see you soon. Thanks, Deb.
Thank you very much. Have a great afternoon.
Bye, everyone.